This is the final episode of Brian's story. We have heard about how Brian suffered febrile convulsions as a child and later, when he was 28 years old, had a car accident which may have been caused by a seizure. About 2 years ago, Brian had a seizure which was witnessed and described by his girlfriend, and I was fairly confident that these were temporal lobe seizures. An MRI at that stage revealed changes suggestive of scarring of the right hippocampus. And over the last 2 years, Brian has continued to have seizures every month despite trying 2 different anti-epileptic drugs. He's not able to drive because of the seizure, and he can't work as a storeman because he needs to use a forklift. I've suggested to Brian that the next step will be epilepsy surgery, and I've asked him to discuss this with Lindy, a neurosurgeon who will carry out the procedure. So Brian, since we last met, you've spent some time in hospital and we've recorded your EEG for 24 hours a day, and we were able to capture about 4 seizures. Unfortunately, the EEG didn't show us where the seizures started from, but we were able to do an ictal SPECT scan which shows the changes in blood flow at the time of a seizure. And that pointed to the seizures beginning in the right temporal lobe, which is the same part of the brain that was affected in the MRI scan. It's also the same part of the brain that shows abnormal glucose metabolism in your PET scan. In people with epilepsy, the seizure focus produces less energy. The neuropsychological tests show that that part of the brain can be removed without damaging your memory.
So Brian, all of the tests point to the right temporal lobe as being the focus for your seizures. And since you're still having seizures, even though you're on good doses of 2 medications, we should think about surgery as an option. That would mean removing the right temporal lobe where we think the seizures are starting. There are risks associated with the surgery, so I will go through the procedure and the risks so you can decide whether or not you want an operation.
Will the seizures stop after the operation?
In a case like yours, there's a 70% chance that the seizures will stop with an operation, whereas only 10% chance if you try another medication with your neurologist. We'll shave some hair on the right side of your head and make a cut in your scalp, then remove a window of bone, open up the coverings of the brain and take out the right temporal lobe where we think the seizures are arising. So the particular risks of the operation. So Brian had an uncomplicated temporal lobectomy and he's been seizure free for 2 years now. He's back at work and he and Jackie got married a year ago. They're expecting their first child any day now. Isn't that great?